Assalamu alaikum. My name is Farahat Ashraf and my roll number is EP1770037. And today, the research article I am discussing is Anti-epileptic drug evaluation in new animal model. And in this, I am discussing spontaneous petit mal epilepsy in rat. So first thing we should know that what is petit mal epilepsy, and as epilepsy is a nervous system disorder in which there is abnormal brain activity which causes sensations, which causes seizures, which causes um, loss of awareness, etc. And these seizures are temporary changes in the brain activity. Whereas petit mal epilepsy is also called as absent seizures, and these are this seizure is basically due to loss of consciousness for a short period of time. It can be less than 15 seconds. In petit mal epilepsy, the individual stare into space for few seconds, or we can simply say that it this seizures causes blank out. Now, as we know that various animal models are used in experimenting epilepsy and to determine the efficacy of anti-epileptic drugs. So here I am discussing the petit mal epilepsy in animal model of petit mal epilepsy in rats. In this model, laboratory breed threats are taken, which were in which the recurrent seizures were observed, and these seizures were observed from EEG test. This EEG test means this EEG test is electroencephalogram test. Basically, this test is used to determine the brain conditions, and in this it detects the electrical activity of the brain, and which is useful in diagnosing the epilepsy, in diagnosing the seizures disorder, etc. And in this EEG test, we use the electrodes which are attached to the scalp. Okay, now the anti-epileptic drugs we used in this model is ethosuximide, dose greater than 12.5 mg per kg, diazepam dose greater than 0.5 mg per kg, and trimethadone and sodium valproate greater than 50 mg per kg. And these drugs are shown that they suppress discharges in a dose-related manner. So first, we should know that the mechanism of action of these anti-epileptic drugs. Ethosuximide also its brand name is Zerontin, and it is a medication that is used to treat absence seizure, which is also called as petit mal seizures. And whereas diazepam, as it belongs to benzodiazepine family, so it acts as anxiolytic, means that it relieves anxiety, and it is also used to treat seizures, alcohol withdrawal syndrome, etc. And whereas trimethadone, it is an oxazolidine anticonvulsant, and it is also used to treat epileptic conditions, which those are resistant to to other treatments. And sodium valproate is also used to treat epilepsy, and it is also used in the treatment of bipolar disorder and migraine headaches. Now, in this animal model of petit mal epilepsy, we used Vista rats, which were exhibiting spontaneous spike and wave discharges. And these spikes and wave discharges were recorded on EEG during a spontaneous absence. The number and duration of discharge varies from animal to animal, and the average is that they last for more than 10 seconds per minute. As I said earlier, that in petit mal epilepsy there is loss of consciousness for short time period, usually less than 10 seconds, usually less than 15 seconds per minute. Okay, so when these rats were exhibit these spike and wave discharges, behavioral arrest with with clonic twitches of fibrissa, and face and neck muscles clonic twitches was observed. Basically, clonic twitches are involuntary muscle jerking of face and neck is observed, and involuntary muscle jerking of vibrissa. Vibrissa are long stiff hairs which are grown around the mouth of the animal. So these clonic twitches were observed. And the rat's pharmacological reactivity to various anti-epileptics were observed then, and we discussed the pharmacological model of petit mal epilepsy. In this model, the material used is that we use 26 Vista rats, and these Vista rats are divided into groups, and each group contains 6 rats, and each rats uh, each rats have EEG device were attached to their scalp, and this EEG device carried cortical monopolar electrodes which were implanted to the scalp of the rat. The drugs which are used as anti-epileptic in this as anti-epileptic, and their preparations are as diazepam is a commercial preparation of injectable diazepam is taken, and it is diluted in normal saline. Sodium valproate was dissolved in normal saline, and in trimethadione and ethosuximide was taken, and it is mixed in mixture of water which is 50%, propylene glycol 40%, and ethanol 10% were used. And then the first dose was tested. The first dose of each drug was tested was 10 times the minimum dose that is commonly used in humans. And then the dose levels were changed as we get the results and as we observe the results. Then after giving the dose, the EEG and clinical signs were recorded for 80 minutes, uh, and in between these 80 minutes, 4 successive 20 minutes post injection period was measured and recorded. And in this way we in this process in this method in this way we observe the efficacy of given dose of anti-epileptic drug, and the results are expressed in percentage of the reference period discharge. Now, the observation. Now, we take 3 readings: reference reading, control reading, and test reading. In reference reading, the rat was habituated in the experimental cage for 15 minutes, and then EEG was recorded for 20 minutes. Whereas in control reading, the appropriate solvent was injected, but it was alone. There was no anti-epileptic drug in control was present. In test reading, the dose of anti-epileptic drug was injected intraperitoneally and in a volume of 2 ml per kg into 6 rats. In results, in now the results. In After performing the test, the results obtained was that in the control experiment, the injection of solvent as in alone was given, so there was no modified seizure activity. Whereas in case of the anti-epileptic drugs, that is ethosuximide, diazepam, trimethadione, and sodium valproate, suppress the discharges in a dose-dependent way. This dose-dependent way is very important, as we can see that mean efficacy was greater than 90% for ethosuximide when given in a dose 50 mg per kg, diazepam 2 mg per kg, trimethadione 200 mg per kg, and VPA 200 mg per kg. Now, the conclusion. From this research article, it was concluded that in animal models, seizures are evoked by giving the epileptogenic drugs. By inducing epileptogenic drugs, basically epileptogenic drugs are those drugs which are capable of causing epileptic attacks. And the seizures are also evoked by following intraventricular injections, electrical stimulation of brain, etc. And these seizures were transient, means that these seizures were temporary, and the effective doses of drugs which are found to be effective are higher than are in model. This means that as in our model the seizure were induced in the animal, and it is unlikely to be same as the pathophysiological mechanism of chronic seizures. Therefore the comparable responses to drugs in model differ greatly. Therefore the effective doses of drugs found are higher than in our model. So the beneficial effects appeared in our rats at following doses of the drugs. The ethosuximide shows beneficial effect at 12.5 mg per kg, diazepine at 0.5 mg per kg, trimethadione at 50 mg per kg. The most important drug was is found to be sodium valproate, as it becomes a drug of choice. Why? Because its efficacy was low or null at 50 mg per kg. So, in this article, it was concluded that the effective dose of various drugs were similar in rats and humans, and it did not induce secondary effects in rat as well, and thus these criteria demonstrate the pharmacological validity of animal model. That's all from my side. Thank you so much.